I'm Dr. Larry Burchett, and this is your 5-minute weekly coronavirus update for August 7th, 2020, powered by Averpoint.com. This week with Shovik Banerjee and Dr. Kermit Jones, MD. We explain to you the connection between high blood pressure and COVID. I walk you through the time from exposure to getting symptoms to getting sicker. As always, we begin with the numbers. Shovik.
Thank you, Dr. Burchett. Now, the story this week was a tragedy. 1,100 daily deaths from COVID-19 in the United States. That's up 10% in a week. That's up 120% in a month. Now, the possible good news is daily cases, which tripled in June and July, were down 10%. Hospitalizations, which doubled in July, were down 10%. Regionally, the South and West drove this decline. Many states down from their peak numbers. Florida, 50% down. California, 30% down. Texas, 20% down, though they saw a slight bump at the end of the week. Now, the Midwest, where cases tripled from 3,000 to 9,000 in June and July, saw new cases stay flat this week. And we're hoping states like Illinois, Indiana, Wisconsin, Michigan have hit a plateau. Now, there's a few reasons we can't assume this week's new case decline is a trend. Number one, we tested 10% fewer people. Number two, there's a testing logjam. So bad that 6 governors got together and created a regional rapid antigen testing strategy. Number three, the virus is spreading to rural regions where people are getting infected but are really far from testing centers. And number four, states remain committed to reopening schools. And so we'll see what effects that creates over the next few weeks. Now let's talk about the world. Big numbers still coming out of the US, South America, India, South Africa. But let's talk about the countries that made headlines last week for big numbers after containing the virus. South Korea saw 113 cases in a day last week, the most they've seen since March. These turned out to be soldiers coming home from Iraq. They were tested and quarantined, and South Korea's numbers are quickly back down. Vietnam, not so lucky. They saw their first community outbreak last week, 11 cases in 3 days. This week, they were seeing 30 to 40 cases a day. They went from 0 deaths throughout the pandemic to their first 8 deaths. Now, they've implemented strong lockdown measures, including they're committed to testing every one of the 1.1 million people in the city where the outbreak occurred. Now, France, Germany, and Spain made headlines last week. Now, these numbers have stayed up. And when you zoom out, it looks like it's part of a broader trend. In June, each country was seeing about 500 new cases a day. Spain is now at 3,000. France is at 1,500. Germany is at 1,000. It looks like young people are tired of the lockdown. They're out and about. They're not wearing masks. And they are a large share of these new cases. So when you step back and look at all these countries, it tells us even a country with low numbers is at risk of a sudden outbreak. Testing and quarantines can contain the outbreak, but if you lose the will of the people, if they stop believing in the lockdown, the numbers will go back up. So let's hope these countries can turn it around. And now to Dr. Jones.
So we've talked about COVID comorbidities like obesity and diabetes. Now let's talk about another comorbidity, high blood pressure. Patients with high blood pressure are at greater risk of complications from COVID-19, especially if it's untreated. So let's take a step back. What is high blood pressure or hypertension? The American Heart Association recently redefined stage 1 high blood pressure as that blood pressure that's higher than 129/79. The top number is the systolic blood pressure, the pressure when the heart contracts, and the 79 is the diastolic pressure, the pressure when the heart relaxes. What's the prevalence of high blood pressure in the United States? It's 29%, but it increases with age. Only 7.5% of young people under 40 have high blood pressure, but 63% of people over 60 have high blood pressure. There seems to be a regional association as well, with populations in the South and Midwest on average having higher pressures than those in the West or Northeast. It's also been linked with socioeconomic factors, with populations of people with less than a high school education having 30% more hypertension than those with a college education. So why does high blood pressure increase the risk of COVID-19 complications? Scientists are still investigating and the evidence is mixed. But here's what we know. The early studies in China, Italy, and New York showed higher COVID-19 morbidity among hypertension patients. It was unclear whether hypertension or some other comorbidity was what was increasing severity, or whether the blood pressure itself was an independent risk factor. So why would there be a link? In July, an Italian study of 40 patients explored how COVID attaches to ACE2 receptors in the lungs. These receptors normally help decrease blood pressure. But the study theorized that COVID may upset the normal ACE2 response, resulting in higher blood pressure and unchecked inflammation. Now, some have theorized that blood pressure medicine, and not high blood pressure itself, might contribute to COVID-19 severity. But a US study of over 10,000 patients did not find a clear association of ACE inhibitors and COVID-positive tests. However, they did find a lower rate of hospitalization in patients whose blood pressure was controlled. Now, while researchers figure out exactly how hypertension relates to COVID-19, the key is, if you have high blood pressure, you're likely to be at greater risk, and you should make sure that your blood pressure is under control. So stay tuned as the results of better studies come in. We'll summarize the best science.
So let's talk about this thing called the natural course of COVID. When you get it, when do you get symptoms? Which symptoms are you worried that it's progressing? When should you go to the ER? After exposure, it takes about 4 days to show symptoms. We call that an incubation period. Now, we're going to be talking about averages, on average 4, but there's a range of 2 to 7, for example. Now, remember, most people, maybe half, over 50%, never show any symptoms at all. Okay, but for those who do, what are the most common symptoms? I'm curious. What have you've heard a lot of things. So about half of people had fever or cough. A third have shortness of breath, body aches, or headache. Less than that, maybe 20%, have abdominal symptoms like abdominal pain, nausea, vomiting, diarrhea. You can also have a sore throat. Now, less commonly, you've probably heard about losing your sense of smell or taste. It's about 10%. It's not as common. This is from CDC data of over 1 million infections in America. Now, which of these symptoms are we worried about that means somebody's getting sicker? As an ER doctor, shortness of breath, number one. It makes me worry that COVID is passing into viral pneumonia, affecting your ability to get oxygen into the blood. The shortness of breath typically occurs about 5 to 7 days after symptoms have started. It's a reason to go in. Now, again, we see this, shortness of breath, the complications more commonly, you've heard this, older folks who have multiple medical problems, specifically diabetes, high blood pressure. Now, for those who do get sick and need to be admitted to the hospital for oxygen, this happens around day 10. And for those who get sicker and need to be in the ICU, that's around day 12 after symptoms started. And this is about the time when we talk about this cytokine storm, or the body's own immune system having a reaction that leads to damage. Things like causing clots, kidney failure, clots in the lung, heart disease, heart failure, strokes, sepsis, and other infections. All of these kind of things that contribute to somebody eventually dying. When people die, it's about 3 weeks after symptoms start. Again, that's on averages. Now, so let's put it all together. You get symptoms about day 4, shortness of breath about a week, end up in the hospital at almost 2 weeks. When you get sicker, people die about 3 weeks. Now, look, here's some good news. Don't forget, most people who get this don't even show symptoms. Most people survive. Those that are admitted to the hospital, they also survive too. The people that get it, typically their symptoms are gone within a couple weeks. Now, for more severe cases, it can take 3 to 6 weeks for symptoms to go away. It's a little bit longer. And I've had patients I've seen in the ER who have lingering symptoms of headache, fatigue, cough from COVID for weeks. For Shovik Banerjee and Dr. Kermit Jones, I'm Dr. Larry Burchett. Thank you for joining us on your weekly COVID update. Please share this. Check out the evidence for yourself at averpoint.com. Stay safe. Do your part. We'll see you next week.